Canada's borders just reopened to travelers vaccinated against COVID-19, and already there have been some changes that affect business aviation operators. From the National Business Aviation Association, this is Flight Plan. I'm Rob Finfrock with your trusted source for business aviation news. After nearly 18 months of being essentially locked down to anyone from outside the country, Canada reopened its borders August 9th to travelers from the United States, and 1 month later to vaccinated passengers from around the globe. We outlined the new requirements for traveling into Canada in an earlier episode of Flight Plan, but we thought it would be a good idea to check in on how things are going since that time when it comes to flying to our neighbor to the north.
The things that we have really received feedback on deal mainly with the ArriveCAN app and the calls to the telephone reporting center.
Luis Nambo is the Master Global Regulatory Specialist at trip support provider Universal Weather and Aviation.
So initially, some of our operators were a bit confused as to who exactly needed to submit information on the app, whether it just be the pilot in command, or if it's a family, only one person does it. Some little confusion there. And then what needed to be done with the receipt codes afterwards. Our operators quickly got the hang of it, learning that the pilot in command had to provide the codes to the telephone reporting center. Then about a month later, on September 7th, Canada opened its borders to all fully vaccinated travelers, regardless of citizenship. This, of course, increased traffic, which was felt by the wait times with the telephone reporting center. We have heard stories of lengthy on-hold times, some taking as long as 1 to 2 hours. Even myself, when I've called to update ETAs with CanPass, it always says the minimum wait time is at least 15 minutes or more.
And adding to those requirements came an expanded list of restrictions issued September 17th by Transport Canada. Here to tell us more about that is Scott Harold, member of the Board of Directors and Treasurer for the Canadian Business Aviation Association, CBAA, and the President of Sky Aviation International.
CBA is constantly talking to Transport Canada with reference to the enhancement and trickle-down effects of business aviation coming into Canada. Some of the updates on that, again, do deal with, as mentioned earlier, on the ArriveCAN app, but we've had quite a few arrivals from the United States lately on aircraft with basically pretty clean entry and departure. Weight restrictions and so on, not affected as of yet in my book, but we basically just encourage everyone to over-prepare. And I think the others may seem that works the best. But the restrictions basically are just on type of COVID tests and basically essential or non-essential business, and also some of the quarantine aspects. But they haven't really hit hard yet on certain things as far as entrance into Canada. It's the same.
Should we expect these restrictions to get perhaps more strict as time goes on, Scott?
Well, we are dealing with the third wave, as many countries are these days, and we hope that, again, the preparedness aspect should prevail. But we just finished an election in Canada, which has sent a little sigh of relief, I guess, to a point where we don't have a brand new government coming in and changing things upside down. But there's still that requirement for the COVID test. Doesn't matter if you're vaccinated or not. There is the requirement to make sure your second dose of vaccine was at least 14 days prior to the trip. Provinces have now implemented Q-scan codes going into restaurants, bars, gyms, a few things like that. So there's nuances there that, as far as preparedness goes, and your identification of your essential crewness, especially for the crew, and willingness to stay near the hotel, a few things like that still apply. And again, we encourage everyone to carry that PHAC letter, which is the Canadian Public Health Organization, with reference to the essential aspect of crew.
My third guest today is Ron Renz, president of aircraft certification and flight testing firm Alligator Incorporated. Ron, I understand you recently flew a trip to Canada. Please tell us about that trip, and were there any unexpected issues along the way?
We go to Canada about 2, 3, 4 times a year. We've got a lot of family up there. Most of our trips to Canada are family related. This was the first trip we took since COVID happened. We went up on the 4th of September and came back on the 17th of September. We had no problems at all. There was a little bit of confusion using the ArriveCAN app because we were coming in with a private airplane and they asked for your airline. Well, nowhere in the instructions does it tell you how to do that, and you got to fumble with that a little bit. And what you got to enter under the airline is other, and then under the other airline you say private, and flight number you either make up a number or say not applicable, and then after that it all goes fairly well with that app. Both my wife and I, well, there's two of us traveling on that trip, as my wife and I, we both had the ArriveCan app on our phone. I had a problem making it work on mine. She had no problem at all. What we discovered out of that is actually quite good, is that one person can do the ArriveCan for all passengers on the airplane. There's a function in the app that allows you to add travelers. When you do that, though, you have to have access to the other travelers' passports, and you have to have access to the other travelers' vaccine proof if you're not a crew, for example. The advantage of one person doing it for the entire flight is when you land and you talk to CanPass, one of the questions that they ask you is your ArriveCan number, which you'll get after you fill it out. You'll get a number that says, hey, here's your number that you need to use. And if one person does it, it's the same number just with a dash for all the other passengers. That makes it easy. If it's a corporate operation where you've got a number of passengers, it probably would be easiest for one of the flight crew members to do it for all the flight, because then you know you've got all the stuff done properly and easily, which makes it seamless. I think if you have some people that aren't that familiar with traveling with business or general aviation airplanes, they could very easily get confused by that and don't know what to do for airlines and that sort of thing. And then that worked quite seamless. As far as flying into Canada, all the normal procedures you got to do. You got to do EAPIS, you got to do CanPass, and now you got to do this additional ArriveCan thing. We were both fully vaccinated, so we just took advantage of that. I know that for flight crew, you don't need to be fully vaccinated or tested, and the ArriveCan app allows for that. And then you just enter that you're a flight crew member, you're traveling for transportation, and that works. I think, as Scott was saying, the thing that you need to worry about, mostly for flight crew that might be coming in without full vaccination because they don't have to have it, is what they'll be able to do when they are in Canada. We were in Winnipeg in Manitoba, so I can't talk about the other provinces, but in Winnipeg, basically if you want to do anything, either a restaurant or a bar or art gallery or some kind of a venue where there are inside where there are other people and public involved, you are going to have to show your vaccine status. You know, we used our CDC vaccination cards to get into restaurants, and that was not a problem. But you have to show two pieces of ID. You got to show a photo ID, and you got to show your vaccination status. And they'll check to make sure that the names are the same. And that's important. Anybody that's not flight crew, if they're trying to operate without vaccination status, there are some exemptions that you can operate under. If you go to travel.gc.ca under air, it gives you all kinds of exemptions you can get for that. All that's doing is exemptions to let you come into the country and clear through customs. It doesn't address at all what you're going to be able to do once you're there, you know, where you're going to be able to go and all that stuff. And that's, I think, the thing about that. The requirement to get into the country may not be the same as the restrictions that you're going to be subject to when you are there. And that's really, really key. And I think that we travel also internationally quite a bit outside of Canada, and I think we're going to see more and more of that. And I think the reality of the situation is, if you're going to try to travel anywhere, you better get vaccinated and you better be able to prove it, because otherwise you're going to have significant restrictions on where you can go and what you can do.
We'll have more about Ron's trip in just a moment, but first, this word from NBAA.
NBAA Flight Plan listeners, are you ready for the convention? It's back, it's nearly sold out, and it's going to be a game-changing event. Join us by visiting nbaa.org/2021.
We're back now with Luis Nambo, Scott Harold, and Ron Renz, and our discussion about flying between Canada and the U.S. in light of updated restrictions related to COVID-19. Ron, before the break, you provided a very detailed description about your trip to Canada. What about your trip home?
Coming back into the States, there's a requirement that you got to have a negative COVID test within 72 hours of coming back into the States. And again, it's the over-prepared thing. Check, check, check. We called the customs off. We usually, when we come back from Winnipeg, we usually clear at Fargo, and we know that stopped quite well. We've called the customs officer, asked him about that. He said, oh, no, you don't need a negative COVID test. You just come on through. So we went and got negative COVID tests to come back just so we're not going to have any problems. That turned out to be an interesting operation to get a negative COVID test in Canada, because everything in Canada, at least in Manitoba, is tied to your Manitoba health card. Well, if you don't live in Manitoba, you don't have one of those. So we called around, and all the numbers we called said, oh, no, we can't help you. You've got to go this, and you got to do this, and you got to do that. And it's like basically there was no way to get a COVID test. So we called the FBO up in Winnipeg and said, hey, do you have a place to go for a COVID test? Oh, yeah, here's the number you call. So we called those places, and that's really fun. Oh, yeah, we can get you a negative COVID test, and you'll get your results in less than 24 hours. And it only costs $400 plus tax per person. Well, for two people, that's $800. It's Canadian, so it's a little less, but nevertheless, if you've got a larger airplane, you got 8 or 10 people, that gets to be a substantial amount of money. Well, what we ended up doing, we talked to some friends there and said, oh, no, you don't have to do that. There's all these mobile COVID testing sites around Winnipeg, and none of them are ever busy. And they pulled up an app and said, here's where they are tomorrow. So we went there and said, hey, you need a reservation to get there. But we talked to the folks, said, oh, no problem. Just stand in line, you get your COVID test. And we got our COVID tests. Then the next problem is getting the results of your COVID test, because you don't have a Manitoba health card. You can't just go online and get your results. So they give you a phone number to call. The downside of the phone number to call, you're going to be on hold for about an hour to an hour and a half. And you got to be prepared for that and ready for that. And then when they get your results, and it's tied to, we used our passports, it's tied to your passport number. They gave you the results, and then they texted the results to your phone, and that's how you got that. That was kind of a little glitch. It turned out we didn't need those, but again, it's being prepared for something that you might need is better than not having what you do need.
Luis, what about restrictions for passengers entering Canada who aren't vaccinated against COVID-19?
So for travelers that are unvaccinated, they still have to go through all of the original requirements. They still need to have a quarantine plan in place whenever they do go into Canada. So that sometimes messes things up. But whenever you have a group of travelers that are vaccinated and other ones that are not vaccinated, so they can't always make their plans come to fruition. And even then, the ones that do go in usually tend to be going in on the exemption status. But again, they still need to have the 14-day quarantine plan in place. That has really honestly just been the main thing. It's just more so the ones who are vaccinated versus unvaccinated that we've seen so far.
Scott, what other tips do you have for operators flying into Canada in light of these requirements, particularly as we might still see even more changes in the near future?
For now, continue the path of getting the COVID test prior to coming into Canada, carrying the masks, getting back to basics. Again, I encourage anybody to carry that PHAC letter, which basically explains travel into and out of Canada. That does the health aspect to it. Be aware, that provinces are now into the Q-scan codes for restaurants, again, bars, gyms, anything that's sort of a public event, if you will, even a sports event, and carry your vaccine cards. Just carry things that you don't usually do as far as identification is concerned. You don't need your passport everywhere you go around in the provinces, but I mean, 2 forms of identification, I think Ron was mentioning, is key, with your vaccine card. I would just stay that course for now. Things may hopefully relax, but we are now all concerned a bit on, this third wave and how we're going to be affected on that. The overall consensus basically is just to maintain the preparedness. And I do really encourage, and maybe Louise finds this as well, for crews to carry around the public health PHAC letter, which basically states the essential requirements, the business allowed in coming into Canada, stuff like that. That usually does shut down any questions that they may have. And unlike the U.S., where CBP really focuses on their entrance requirements coming into the United States, CBSA will kind of lead into the COVID health requirements, and they have questioned many flights on the basis of not coming into Canada doing business, but coming into Canada, have you satisfied all the COVID requirements? So they do have leniency where, in fact, sometimes you do get gray area in there. So hence the preparedness aspect. You may not have Transport Canada or PHAC asking you questions. You actually may have CBSA asking you health-related questions. But to have Ron's experience and Louise, it's just the same as always. It's just being prepared and asking questions prior to your trip.
What tips do you have to share from the trip support perspective, Luis?
I want to touch a little bit more on the testing requirements when you come back into the U.S. When the CDC order came out regarding the 72-hour COVID test requirement, CBP officers were advised that they were not to enforce it. It's in CDC's jurisdiction, so CBP officers shouldn't be asking for that information. There are some ports around the country, in my experience from setting up customs, where some officers do ask us preliminarily, do the passengers have negative COVID tests? So some officers are asking for it, but most officers should not be asking for it. They have been advised not to. However the case is, though, travelers should always have that negative COVID test coming back into the U.S. should CDC ever decide to audit operators.
Ron, anything you'd like to add?
The things that'll get you are the things that you're not prepared for. And that's, I think, with the whole COVID thing. And I know there's some new potential testing requirements coming in for anybody coming into the States that's not vaccinated. And that's going to be like within 24 hours. And then after you get back within 24 hours, you get tested again. And there's some quarantine things and all that. So it goes back to the rules change. They can change daily. You better check daily if you're going to go. I mean, we went up on the 4th, came back on the 17th. Well, on the 15th and 16th is when I started checking to see what the rules might have been changed in that almost 2-week period we were up there, because there were a few minor changes. But if you prepare for them, it's no big deal. If you don't prepare for them, that's where you're going to have gotchas, I think. So for us, it was pretty seamless, but that's because we did the homework.
And for your homework, should you plan to travel into Canada in the coming weeks or months, be sure to check out the Canadian Travel and Tourism site at travel.gc.ca and scroll down to air travel for the latest advisories and requirements. Similarly, visit travel.state.gov for the latest information on requirements and restrictions when coming back into the U.S. And for all the latest COVID-19 related developments affecting business aviation travel worldwide, visit nbaa.org/coronavirus. And that's the latest from the National Business Aviation Association. Remember, you can subscribe to all Flight Plan episodes at Apple Podcasts in the App Store, wherever you find your favorite podcasts, including by asking Alexa or another connected device, or download them from nbaa.org. I'm Rob Finfrock. Thanks for listening, and be sure to join us next time for a new episode of Flight Plan.